Okay. Thank you. Good morning, and thank you all for coming. We really appreciate you taking the time to join us this morning. My name is Joe Scopoletti. I am the president and CEO of the Guthrie Clinic, our organization here, and across the Twin Tiers. I want to take the opportunity this morning to talk to you about Guthrie and what's going on in our organization as the coronavirus COVID epidemic starts to grow. These are really unprecedented times. In my career in medicine, I've never encountered or even heard of anything like this or of this magnitude. And in particular, the rapidity of change of what's going on around our country and the world is really the unprecedented part. So almost every day, the rules, the guidelines, the plans need to be changed and modified. And so we thought at this point that it would be worthwhile for our communities to know a little bit more about what we're doing as an organization to be prepared for this and how we're managing through this. I want to just start with kind of our three areas of focus. So the first and foremost, we are focused on containing the spread of the virus. That's a critical part of this. The second is we are committed to the safety of our patients and our staff. And the third is a preparation for what now everyone believes will be a surge or an expansion of the number of people that are affected by this virus. So really three priorities of equal importance, but very, very critical for us and for our community. So I want to spend some time today getting some information out to you and having the opportunity for you to ask and get answers to questions specific to our preparedness and how we anticipate this next couple of months will go. So with that, we have established a kind of a group of internal experts, people that have in their area of responsibility a component of managing through this. And so first I want to turn it over to Dr. Mike Scalzone. Mike is our Chief Quality Officer and responsible for things like patient safety. And I want to give him the opportunity to tell you a little bit about what's going on. Michael?
Thank you, Dr. Scopoletti. So we understand that this changing situation raises a lot of concerns and sometimes confusion. So what I would like to do is speak a little bit to the current status here in our area and what our preparedness is, the things we've been doing to prepare for this. I'm going to start with testing because I know that's always a point that people are concerned about. So this changes rapidly, and the most up-to-date information is at the Department of Health websites, and that's where we get our information on a regular basis because the public health departments are those that report the cases when there is a positive. So in the state of New York, there's been about 2,372 positive cases. In Pennsylvania, there's been 133. None of those patients have been positive from the Guthrie laboratory or in the Guthrie hospitals. So at this point, we have not taken care of any patients that have COVID-19, nor have any of the tests we have done positive. We have done 134 tests so far. I'd like to walk through the process of what happens with testing. You were all screened as you came in here, so you were asked questions and had your temperature taken, and that's what happens when we have patients come to the institution. They go through a very similar process. If one of those questions about travel or fever or other symptoms is positive, or if they have a temperature, what happens is that patient is then given a mask to put on and they're taken to a room as rapidly as possible to a place where they can be isolated. One of our staff then puts on protective equipment and will do the testing, which is at this point a nasal swab. We call the Department of Health prior to doing the actual testing to make sure they agree that this is an appropriate person to be tested. So that's what happens with the testing process, and that's what we have done so far 134 times. Dr. Scopoletti mentioned the three parts of what our focus are: containing the virus, protecting our patients and staff, and preparing for a surge of patients. So I'd like to go through a little more specifics about what that means. The first is that we have what we call an emergency operations center. So this is a centralized location where we collect all of our information, where we disseminate that information, and where we ensure that we have readiness for any activities that may happen. We opened that emergency operations center weeks ago, knowing that this may happen, and we've escalated the intensity of that over time. And we'll continue to do that should we begin to see more patients coming in our direction. We really do believe, as you'll hear other places, that it is relatively inevitable that we will have positive cases in our region. There really is no one-size-fits-all solution for something as complex and rapidly changing as this. But we are very familiar with the emergency operations concept, and we do this regularly when there are other issues that may arise that would impact the health of our communities or in our organization. So to specifically let you know what we have done to limit the spread of the virus or the potential spread of the virus, we have eliminated almost all visitation. There are select areas where that is not completely eliminated, but for the majority of our patients, they unfortunately will not be able to have visitors. We understand that that's difficult for our patients, but it really is the right thing to do and mandated by the state in the state of New York. We've moved a significant portion of our employees to a remote workforce, and we're in the process of identifying who can effectively do their job from home. We are essential to delivering care, so most of our employees fall into what's called the essential employee category, so that we are exempt from the New York State regulation that was just put into place yesterday, about 50% of a workplace working remotely. We have increased our capacity to do remote patient visits, our telemedicine capacity. So this is something that we've been doing for a while. We began this quite a long while ago, and what we're doing is we're just increasing the number of patients we'll see and the number of sites. We had already been doing it at almost half of our regional sites across the area. You may be aware we've postponed most or all of our routine office visits. So if someone was to have an annual exam or some routine screening, perhaps a dental screening or an eye screening, we have postponed those visits in order to decrease the number of patients that come to our waiting areas and come to our institutions. We've also postponed non-emergent surgery. Again, that does two things for us. It brings fewer people to the campus and fewer people into close proximity, and it also allows us to maintain appropriate supplies in order to take care of patients that we're preparing for should a surge of patients occur. I think you've all heard that there are national disruptions of supplies for medical use. And so I wanted you to know that we monitor that inventory every day. We understand where those critical supplies are, and we do have adequate supplies to take care of our patients at this time. We monitor it regularly, we have mitigation plans in place, and we continue to order supplies as needed. You've probably also heard that there's been some federal release of emergency stocks. We hope that that is going to come to our area, and we have requested our fair share of that equipment. We know that we can't predict the scope of what's going to happen, but we feel very prepared for an influx of patients, and we'll continue to monitor the situation and prepare as necessary. So with that, I'd like to introduce Dr. Larry Sampson. Dr. Sampson is our chair of surgery for the system, and he'll talk a little bit more about our postponement of surgical cases.
Thank you very much. My name is Larry Sampson. I'm the chair of surgery for the Guthrie Clinic. Our decision to postpone all non-emergent, non-urgent surgery was based upon the safety of our patients, our communities, and our staff in light of an ever-changing national and world pandemic. This decision is in alignment with the recommendation of the Surgeon General, as well as the American College of Surgeons. It is nationwide. You will not find another hospital which has not made this decision. We are working in alignment with hospitals throughout the region and nation in making healthcare decisions for the safety of our patients and our communities. The mechanism with which we have decided which patients are postponed is the following. The individual surgeon reviews the case, and then they discuss it with their section head. The decision is then reviewed with a panel of surgeons and other specialists. This, because of the ever-changing situation, this is reevaluated twice a week. And the process may have to change as time goes on, but that's the process which we have begun and set in place at this point in time. If there are concerns, we strongly recommend you call your physician's office and review your concerns with them. With regards to surgical supplies, as I would underline that we have adequate current supplies to take care of any emergency or any urgent surgery. But part of the reason we are being so cautious with non-urgent cases is because of our responsibility to be able to take care of any urgent or emergent surgery. Guthrie is dedicated to the health and safety of our patients, our communities, and our staff. We will get through this. It's my pleasure to introduce Dr. Sheila Prabhu. She is the section head of internal medicine. She is an expert in the care of adult patients and older patients. She is also my personal physician, so I can speak to her expertise. She has been an attending physician here for 15 years. She's been in our community as a physician for 20 years. Here's Dr. Prabhu.
Thank you, Dr. Sampson. Being an internist and geriatrician in this area for the last 15 years, I have a lot of patients, and I've been getting a lot of questions from patients, staff, friends, family, and I would like to emphasize that this is the time for everybody to be cautious and not complacent, to be very careful and not be in complete panic. I have always wanted my patients to be very healthy, so when my patients have asked me, what do I need to do? I have told them older patients are at more risk, and I say older patients, I mean age above 65, especially if they have chronic lung disease, heart disease, hypertension, and diabetes. So I've told those patients, if you are well, you can stay home. Your well visits may be postponed. But if you're not feeling well and you have a question to ask, please call your doctor or your nurse, and we will be assessing whether you need to come in to be seen. I've also told them it's very important to contain this disease, so practice hand hygiene. Wash your hands at least for 20 seconds with soap and water. If soap is not available, you can use a hand gel with at least 60% alcohol. Also practice respiratory hygiene. If you're having symptoms of cough, sneezing, sore throat, make sure you cough into your elbow, and if you use a tissue paper, get rid of that immediately, and then wash your hands. Stay away from large gatherings. The number keeps changing. Right now, some people are saying 50, some mention less than 10. So I've told them to avoid social gatherings and stay at home. And just make sure they have plenty of medications on hand. And if they are short of medications, please call. As of now, the pharmacies are going to be open as well as the grocery stores. But it's important to keep in touch with their doctor and their nurse, especially if they have symptoms. We abide by the CDC guidelines and Department of Health guidelines. And if patients have symptoms of cough, fever, shortness of breath, they're supposed to call their doctor, primary care doctor, and their nurse and run these symptoms by us, and then we will decide whether you need to come in or whether you can self-isolate at home. Now, even if you're acutely ill, my message to my patients was to always call ahead so we can plan for your care here and notify the emergency room. Again, the symptoms are fever, cough, and shortness of breath. Now, there are some other symptoms which people can have, nausea, diarrhea, sore throat, but from what we have seen, the respiratory symptoms are more prevalent. So my message to my patients is this is the time to be careful, stay at home, and if when in doubt, please call your doctor or your nurse. And I would like to turn this mic back to Dr. Scopolati.
So we are going to open it up for questions, but before we do that, I want to thank all of our folks here today. We want the community to know that we have internally a cadre of experts, specialists in a variety of areas that we can call on to help guide us and help provide for our communities. This organization has been very fortunate to be able to have the kinds of people like Dr. Sampson and Dr. Prabhu and Dr. Scalzone as part of our staff, and we're very grateful. So I will turn it open for questions, and if I could ask my colleagues to come closer to the microphones. Anything you want?
I know your focus has been on healthcare, but how big a worry is the economic impact on the organization?
So the organization's in good stead. So we have managed this organization for 30 years in a pretty conservative model. And so it will be a big economic impact, but we have the resources to withstand this, even if it goes on for a long period of time. It will be, as I'm sure everybody has already identified, a big economic impact to our communities. Other questions? Dum, da-dum, dum.
You always talk about teamwork, and all your providers, when they come to visit us, talk about teamwork. Obviously, that's evident here. You want to highlight that?
Yeah, so, I think I'm going to give that off to Mike a little bit, maybe explain the EOC and how it works, if you wouldn't mind.
So I mentioned the Emergency Operations Center, and what that is in part, it is an actual room that we call Incident Command, but it's also a network of individuals across the organization. And so there is a main Emergency Operations Center here, and then each entity has that. We have daily huddles, as we call them, at each entity, and they roll up, as we described, to a situational debrief each day, right now once a day, but some of the other entities have it twice a day. In addition to that, we have a huddle where our clinicians come together. So we have physicians from all of our specialties as well as nursing. And we talk very specifically about the clinical issues so that we can roll that up and that information to the decision-making group and Incident Command. So I think teamwork is incredibly successful at this point, and that value of how we have had that be core to us for years really shows when we've got an emergency like this.
Any other questions? Yes.
All right. Do you know how many testing kits you currently have at RPH, and what the protocol would be for someone to get tested?
Sure. Michael?
So the protocol remains following the guidance of the Department of Health. And so when someone, what we call screens positive, meaning they answer one of the questions or they have a fever and symptoms, we then contact our infection control specialists internally who have connection with the Department of Health, at which point we will get guidance whether we test that person or not. Okay. And we do have adequate supplies to test for a significant period of time. We have well over 1,000 tests.
About how long are these tests taking? That way patients just know when they're going in isolating how long it's going to be, that it would be about.
Right. That has been changing as well, and it is a little difficult for patients without a doubt. We had initially thought that these tests would return in the 2 to 4 days range. And what we've learned is that same supply chain disruption that's happening for the testing kits is happening for the laboratories as they try to get the results of these tests. So some of them have extended longer. We have tests that were done 5 or even 8, 10 days out and have not gotten the results back yet. Those individuals remain in isolation, awaiting the results of those tests. Sorry.
And then if they are to test positive from there and they've remained in isolation, let's say for the 8 days, do they then continue continue on into another full 14 days, or do they just kind of chip away until they're feeling better, until kind of just,
Yes.
how they should go on about that?
So there are two parts to that. First is, of course, we do have guidance from the public health and from the CDC. It does change. Currently, there are two types of protocols in how those individuals can come out of isolation. One has to do with symptoms and repeat testing, and another comes down to time. And so it depends a little bit, 14 days, 28 days, how that would be. So there are two protocols, and we use the one with the guidance from public health as they give that to us.
I might have a dumb question here, which is
No
normally
such
what I
thing.
usually do. I was sitting at the station, they were talking about why are certain people getting tested, other people aren't getting tested. I want to get my test. If you don't feel bad, why do you need a test? Once you get the test and it comes out negative, doesn't mean you can't catch it tomorrow, right?
There's truth to that. And so
Okay,
the
that's what I tried to explain to them. Why, if you don't feel bad, why do you want a test?
Right. So for the average individual, at this time in our communities, the risk is relatively low. And so what we're trying to do, knowing that there will be further spread of the virus, we know that's going to happen. It's happened worldwide. It's happening in our states. It will happen in our area. We want to slow down the course of that spread. What that allows is a few things. It allows our resources to be maintained so that we can take care of the individuals, and it allows less pressure on our more limited resources, such as intensive care units and things like that. And that's not just Guthrie, of course. That's across the country. And that is the main reason why we don't need to test folks that are not having any symptoms, haven't had any risk factors like contact with someone who's positive or travel to the high-risk areas. But if someone has those concerns, they need to call their physician, and they'll help guide them to when the testing should be.
But I think there's a confusion when people think they need to be tested to prove that they don't have it, and it'll make them feel better.
Right.
I think you're wasting tests on people who don't feel better.
That's exactly correct. And that's why there is guidance of who should be tested and who isn't. So we don't, I don't want to say waste those tests, but use those tests in areas where they're not as important to be done at this time. When there's more widespread testing available, that recommendation may change. Yes?
And this is kind of a silly question, but we've got it from quite a few of our viewers, is the ones that have maybe tested positive or in isolation, they're worried about their pets, and they want to know if they're I know it's silly, but we've had so many comments on, is my dog get sick, is my cat gonna get sick, those kind of questions.
I'm going to ask Dr. Prabhu.
So currently, we are worried about human-to-human transmission. As of now, the World Health Organization has not talked about a human-to-animal transmission. So I would tell the worried that if they are sick and they have even the flu or a respiratory illness, they should probably not be taking care of their pets and have their loved one be the one taking care of their pets. And of course, practice hand hygiene and safety measures. Now, I also want to tell that at this time, we do not want to test the worried well. We want to go as per the CDC recommendations. And the prevalence, we have to look at the prevalence of the disease in the area and look at the epidemiology of the disease. So if the patients have symptoms, they should be calling their doctor, and the doctor then decides who needs to get the testing and who doesn't. Thank you.
Can we talk about those hotlines? That
Yes.
didn't come up, did it?
No.
Like who's manning it and what, just kind of an overall?
Do you have this mic?
Yes.
Okay.
Unless you would like.
Please, no?
So as you can imagine, our primary care offices and other contact points, scheduling points, have been getting a significant number of calls. And we want to try to reassure the public for those that have concerns, but we also want to make sure that we direct those people to the right answers when they have that. So we've put in place a hotline. That hotline is staffed by folks who have expertise in infection control and nurses. And so what they have access to is the algorithms by public health and rapid ability to contact the primary care docs and get those questions answered as quickly as possible.
What's the hotline number?
I do apologize.
We have it in our.
Oh, it's in the packet. Okay,
Oh.
very good.
Thank
Thank
you,
you.
excellent.
Good to know that the media is better informed. It's the way it's supposed to be. What else? I do think I want to close, so it's a little bit of this part about the worried well. testing, right now, the containment strategy needs to be prioritized. And if we test a lot of well people, we're not going to be able to be as efficient and effective at containing this disease. We want to identify people who meet the criteria for testing because they're most likely to be infected and they're most likely to be contagious. Doesn't mean they are absolutely infected, right? But they are the people who have the most likelihood of spreading the disease. So we need to focus the majority of our efforts on those people that have the highest likelihood of spreading the disease because we want to contain that. If we test a lot of the worried well, we are going to end up looking for asymptomatic carriers, which we already know are a small number of people. And so that isn't going to help contain the disease as it is. I want to encourage our communities to use resources that are very good and very reliable. The website for the CDC, Centers for Disease Control, and for the Department of Health in each of the 2 states are very good sources of information for the public. They are not just for us. And so the CDC website in particular is written for the public, so it's easy to follow. It has it's designed by topic, so it can tell you if you have a specific question, pets, there will be a section on pets. And so I'd really want to direct the public to the CDC, Department of Health websites. And then they're going to get consistent messages from us because we're following those same guidelines. The physicians, providers always have some flexibility at the end to decide on testing or treatment, but we must start with a common set of guidelines that are scientifically based, that are very well founded in population health and epidemiology, and those are at the CDC and DOH. And for the most part, they agree with each other too, so it's pretty helpful. So just would close with, this is rapidly changing. It's going to continue to be rapidly changing. What is truth today is going to probably be different by Monday. And so we really think that communications in this era is going to be pretty critical, so we're available if you have any questions. And then lastly, I want to thank my colleagues here, and in particular, I want to thank the staff, our nurses and support staff and physicians who are on the front lines of this, coming to work every day, committed to the care of their patients, recognizing that they are in harm's way, in a way, by what they do. And it's a great group of people, and we're very appreciative of them. Thank you very much.